Good afternoon, Chair Ballendorf, members Garrett Holmes, staff and guests. The lobbies are open and the recording has begun.
Thank you, Gretchen, and welcome everyone. This is the relaunch of the Alcohol Advisory Council. I'm the newest board member, Pete Holmes, and I'll be chairing this going forward. As envisioned, we plan to have this meeting only to be the hybrid virtual and in person. Thank you, those of you who have been here, are here in person. And if you haven't been here recently, the bathrooms are through that exit and take a left. You'll see them. And for those online, I welcome you, and we're going to try and stick with this agenda to make this a good, efficient relaunch. I would ask as we go forward that everyone raise their hand to ask a question or comment, but we're going to proceed first with all of the LCB members that are here, just to give you all a quick update and an idea about what's on the table going forward. And so the round table at the end is when we would like to hear from everyone. But again, I'll call you in order and just ask that you raise your hand. The meeting's going to be recorded, and it will have minutes, and we'll post both to the website afterwards. So with that, I do want to hear first from our other two board members, Chairman Jim Bollendorf and Ollie Garrett. Jim, you have anything to say?
Thank you, Member Holmes. No, just on behalf of myself as the board chair, I welcome you to the relaunch of the Alcohol Advisory Council. I've been on the board since May of 2022, and in my tenure, this is my first attendance of this meeting. So I'm thrilled that we've relaunched this and that we have engaged in this ongoing conversation, and look forward to hearing from all of you today and continuing to engage with you around alcohol policy in Washington State. So thank you for coming.
Thanks, Jim. Ollie?
And this is Ollie. I echo what Jim said, and I'm looking at and I've been on several of these in the past, and I'm looking at the council members, and it's amazing. I think that there are probably only 3 or 4 folks that's part of this that was from the Alcohol Advisory Council before. So I see we have a lot of new faces at these organizations. So I look forward to meeting all of you.
Thanks, Ollie. There are several veterans from the agency here, but there's also a lot of new faces. So this is a great time to get reacquainted. So with that, I think we'll just launch right in and hear from licensing, Becky Smith, one of those veterans that I mentioned.
I was happy you didn't say one of those older people. So again, I'm Becky Smith. I'm the director of licensing. I've been with the organization for a little over 13 years and have been a state employee for just about 35 years. I'm happy to have us launch this advisory council. Again, I think it's important that we hear from all of you about what your needs are and how we're doing as well. I just have a couple of items I want to share with you, and I know that Justin's probably going to cover the rules piece, but I do want to cover about our new licensing system leads, because I'd love to say that it has gone off without a hitch, but that's not the case, that we have had some significant issues, both for our employees and our customers. What I will let you know is that it is a work in progress, that we're hopeful that we are going to have a better, more efficient system, that we know for those folks that are applying for special occasion licenses, that we see those going from 30, 40 days to 15 days, 20 days, which is fantastic. For our liquor licenses, we've actually increased our time frame to over 90 days. So not as efficient right now. Again, I think that's some of the struggles that are happening with people having to change their business process, and us having to change our business process as well. But again, it's a work in progress. Be patient with us. If you have questions in the meantime, feel free to reach out to me. If you're unhappy, feel free to reach out to me as well. staff are doing the best that they can with the system that they've been given right now. The other piece is 1515 that that our licensing team, if any of you have worked with them, know that they're a really dedicated team and they want to make sure that this new rule goes off without a hitch when it comes to what the process is going to look like. That during the rules sessions, there's a lot of questions for licensing or questions around the application process. So we have decided in licensing to launch a training course. So we'll be going over on September 4th at 9 a.m. that we're going to be having a session to cover the application process, that we're going to let you preview the application as well. We want to walk through the operation plan with you. So even though folks can start applying probably as of tomorrow, we ask that you just wait and wait until you have that training. And that way we're hoping for less questions come the time to apply for the application. So with that,
Thanks, Becky.
Thank
And, I realize we started with the veteran, but we should also go around the table so that we all know who we're talking to. I'm Pete.
Will Lucella, I'm the agency director for the Liquor and Cannabis Board.
I'm Kristen Haley. I'm the Public Health Education Liaison here.
Okay. Scott Hazelgrove for the Washington Beer and Wine Distributors Association.
Sean DeWitt with the Washington Hospitality Association. Jeff Mabowski here for Gilbert Gonzalez on behalf of Beer Institute.
Justin Norholm, the Director of Policy and External Affairs.
Lawrence Grant, I'm the Director of Enforcement and Education.
Mark Webster, the Legislative Director of LCB.
Sarah Oki, Research Program Manager.
And I'm Brad Tower. I'm lobbyist with the Washington Liquor Store Association.
How about the folks that are here in the audience?
Roland Thompson, the Wine Institute.
Nice Laflamme, I'm a rules coordinator here at LCB.
And Kevin Walder, I'm the Policy and Rules Manager.
And then lastly, the folks we have online, if we could take them in the order that we have you on the agenda, if you can hear us. First is Andrea McNeely.
See Andrea
Okay.
online right now,
Okay.
but if she is, have her raise her hand.
Paul Beveridge.
Paul Beveridge here with Family Wineries of Washington State. Happy to be here.
Thank you so much. Dan Olson.
Hi, Daniel Olson, Executive Director of the Washington Brewers Guild. Also happy to be here.
Is Mahari Wilson here?
Hi, it's Mari. I'm with the Washington Distillers Guild and I'm here.
Thank you. Carolyn Logue.
Hi, Carolyn Logue here for the Washington Food Industry Association.
Josh McDonald, have you been able to join us?
Yeah, I'm here. Hello, everyone. Josh McDonald, Washington Wine Institute.
Sally Jefferson.
Hi, Sally Jefferson with Wine Institute. I'm the director of the Western States region.
Great. I know Roland is here as well. And then I think that covers everyone we have online and in person. So without further ado, I'm going to go back into the rotation from the agency. And this time, though, you get to hear from a brand new director as well. Larry Grant, please.
Good afternoon. Again, I'm Larry Grant. I'm the Enforcement and Education Director. Been with the state a little bit over 30 months. So not 30 years, but 2.5 years here with the state, and about 6 months of that has been with liquor and cannabis. So yeah, I am responsible for taking care of about 187 staff right now statewide out of the 190 plus on the team, our authorizations on the team. 85 of those work with this industry directly. Some things that we've done recently, our education program, which has been a budding and larger part of our division. We expanded our compliance consultant staff on that team. So we doubled that number. Originally, we had 4 compliance consultants and 1 supervisor. We now have 8 who work statewide with your programs. And what these folks give you is much like the cannabis industry, a different touch, a softer touch with your licensees, with the teams around the state, as far as being able to answer questions, being able to help with some training, or being able to provide you some enforcement and education resources before you need an officer, or before we had to talk anything that had to do with the legal side of what our officers do. Some things we're doing to be more accessible. We've started some online RLS classes. Originally, the plan was going to be once a month that we do those responsible liquor sales classes. But we've seen such an increase in interest in those that we're looking at maybe doing them twice a month, even more, especially as we move in what Becky mentioned, some plans for 15-15. We do know that's going to be, after that training gets done, there's going to be a lot of questions and a lot of interest in trying to get staff trained as we do these different events around the state. So making officers and consultants available to increase that and hopefully help answer some of those questions. And then lastly, we are in a recruitment drive for that 190 plus staff and those 140 officers. Talent is always a challenge across the state, but to make sure we have enough staff to service those 21,000 plus licensees. We're down to about 10 vacancies for personnel from the 30 that we were experiencing over the last few years. But if you have some talent or someone interested in joining our team, please send us our way.
I wanted to jump in quickly and mention that the concept behind these meetings is to have them twice a year, before and after a legislative session. I'm not sure if this counts as a pre-26 session or post-25, but Mark Webster, our legislation expert here, will give us an update. And I can only add that we're going into a short session, barring some extension by the governor. So it's going to be something where we have to be very focused and not expect a lot of legislation, and also mindful of the budget situation.
Absolutely. Good afternoon, everyone. I'm Mark Webster, and I serve as the Ledge Director here at the LCB. I've worked with many of you in the 2.5 years since I've been here at the agency. I think it's fair to say that in that time, our agenda and the agenda of the committee's jurisdiction that we have tended to focus on cannabis, right? It's not to say that there hasn't been any progress on the alcohol side, and I've worked with a few of you on some good little bills in the past couple of years. For this upcoming session, there's simply not a lot to report. We do not have any agency request legislation on alcohol because we don't have any, period. So just a couple of points kind of going from there. When we have worked on alcohol bills, as I mentioned, they've been tinkering on the margins of alcohol policy. That's perhaps not surprising given that alcohol statutes are just full of margins and edges. But I've said this internally, and I would say it here, but I was just struck last session by how often I heard members say they wanted to rewrite, overhaul, rethink, transform alcohol laws in Washington. So both parties, both chambers, kind of a blessing and a curse. I know that I think there's some sticking points that you all have, but you've been dealing with these laws for 90 years, and I think a lot of processes are kind of attuned to them. So maybe that was just kind of an idle thought, and it'll pass. But it'll be interesting to see if that appetite for reform grows. The second observation I just put out is that I would love more data on this section. I think the cannabis data we have is imperfect, but because it's so small and kind of tightly regulated system, we have a pretty good picture of what's going on within it. So I don't think we will ever have or need to have anything like that on the alcohol side. But I think for legislators, our research team, public health and prevention, the media, people are trying to make sense of really disparate data around alcohol, and they're asking us for our help in doing that. We see this in the bill from Representative Reeves the past couple of years, directing the agency to put up a series of dashboards. Everything from compliance rates, compliance checks, to health impacts from all the products that we regulate, revenue that we generate from all that. The bill hasn't passed, but we're starting to do a lot of that work. We have put some data dashboards and support the goal, I think, of that bill. You see it recently in the discussion of the Gallup poll, showing a lower share of adults drinking in the U.S. than in the poll's 90-year history. Is that accurate? It's not exactly consistent with our tax data, but with any of these things, you can spin a very convincing sounding narrative with some of these numbers. What about prices, people's propensity for eating out? Looking at Sean there, what data do we have on how rising food prices impact people's willingness to spend, or is it more on the labor side and the cost of labor? You probably have better data than we do. We don't have any on that, but no one seems to be able to really agree on the problem or even if there is one. So these kinds of things don't really impact our ability to regulate the industry, but it helps us understand it. And it helps us understand where state revenues could go in the future. So when you come to us with policy ideas, having some data around the problem statement, like what are we trying to do here, really helps. And the same with agency request legislation, of course. So when we evaluate some of the potential of the tax changes, there have been all sorts of bills on rewriting alcohol taxation. Data is obviously critical. So again, this is more of like a wish than a concrete ask of you. But as we all bring new data sources into the agency, and I think Sarah can talk more about that, I really just hope that our research team is able to really give us some insights into the industries that you all represent, and that those insights can help us craft smarter policy. So what are you looking at? I've spoken with Josh at the Wine Institute about wine exports to Canada basically going to zero in a very short amount of time. What else is there that you all are keeping an eye on that maybe we should know? That'll pass it back. Next.
Thank you, Mark. Before we go to Sarah about some of the data management that we're trying to research internally, let's go to one of the veterans, Justin Nordholm.
All right. Good afternoon, everyone. I think I know most folks. So a couple of the things since the last time many of us met in the Alcohol Advisory Council or committee. So we have done a couple things around the policy area. And that is bringing in a number of different teams together to have more cohesive debate around policy. So under the policy unit, we have public health, we have rules, we have research, and we have tribal relations. And so all of those different areas can look at an issue together and start brainstorming what are the impacts, what are the effects, and of course we work with our other divisions as well. And I'd be remiss on mentioning that because they do put in a lot of effort and time when it comes to any of the rules. So to cover the rules piece, right now we've got 13 open rule projects. We're planning on getting another one open at the end of July. We were projecting around 15 open rule projects. So there's a lot of rule activity. A lot of it's in cannabis, but we have 5 open alcohol rules at this particular point. So wanted to cover a little bit of some of those because we're working with industry over the spring on product placement. And we actually put that on hold just temporarily. We're picking that back up in September. So I know that there's been more questions coming in on that. We had so many bills to implement this year from the legislative session. I think we had 7 or 8 that we have to get into place. And so we had to kind of put that one on hold to do the mandated work from the legislature. So right now we've got the alcohol product placement that we're working on, and I'll come back to that here in a moment. We've got the expanded outdoor alcohol service, which is 1515 for the FIFA World Cup bill. We also have, we're concluding unacceptable forms of identification ruled, and we're also looking at seasonal hours for beer and wine licensees to combat some of the other issues. And then, of course, with the legislation passing for breweries, we have 1602 and the contract kitchen components. And so we've got a lot of different activity going on. Around the 1515, we've got some draft rules together. A lot of it's prescriptive in statute. We did put out a policy statement so folks could have kind of a general awareness since the bill was in effect July 27th. Licensing is just opening opportunities for those local jurisdictions and licensees to engage. And we're not going to have rules done until after the end of the year. Most likely it'll be January. And so with that, we're trying to put forward a lot of communication, and we want to stress that there's a lot of questions right now coming in around the differences between permanent rule and the 1515 implementation, because there's a sunset on that. And it's also limited to the civic centers and the fan zones, et cetera. So licensees who are just working independently with one another or with their community is they don't get all the privileges that are in 1515 because they are very specific around the different activities. And so if folks have questions, please send those in and we'll be happy to try to help navigate some of that. On the acceptable forms of ID, we're just expanding that to open 2 more. The green cards, as well as the Nexus cards. And so those will be deemed acceptable for proof of age with alcohol sales. Seasonal hours, we're trying to build that policy to allow these seasonal businesses like in the San Juans or up in the high countries where they just don't have wintertime customers. And so bringing that down to a minimum of 2 days a week so they're still a bona fide restaurant, et cetera. We're hoping that can offer some relief to those particular licensees. There's still, and Becky, please correct me if I'm wrong, but for those who just want to close during the season completely, there's still temporary discontinued businesses options that are available. So it doesn't have to be, you have to be open. You can do that temporary discontinued business. And then if you are open, we're reducing the requirements in that particular space. Contract kitchens, we've been having a lot of discussion around what that looks like because food trucks can help facilitate the requirements for the restaurant when it comes to the breweries and microbreweries, and that's it. And so with that, there's been questions around do the trucks have to be on site at all times? Do they have to be up on blocks like we've seen in some areas? Can they be mobile? The bottom line is if you're going to have a food truck in particular instead of a contract kitchen within your facility, is it has to be on site. It has to be making the food there. And they have to have the meal requirements for that particular business. So they can't just come and pull in for a couple hours and leave. If they're not meeting the mandatory minimum hours of operation, the level of food services required for those licenses, et cetera. So we're trying to make sure that that's clear in the regulations. And then I'll just come back and touch on the alcohol product placement. So really want to thank everybody in the industry groups that we've met with. We had a big meeting in the spring. And quite frankly, it was really nice to see everybody there and offering constructive feedback because our first draft was definitely broad. And we knew that going in. We're trying to figure out how to make some of the improvements in these areas. And the ideas and the concerns that were expressed were definitely valuable. We were able to think things through on a number of different issues. We had subsequent independent meetings with a lot of folks that wanted to have that. So that's one of the reasons that this did also get pushed out a little bit because we were going through that before we wrote the follow-up draft. And I think people will be pleased to see a lot of the changes that we discussed in those previous discussions will be in the next draft. And one of the things that was nice to see is some of the key points that we had around, securing some of those easy to steal items, as well as the crossover products. We had general consensus from all industry members. We had some dissent, but we had the vast majority were understanding and they're like, yeah, that makes sense. A lot of other things didn't make sense and that's fine. And you'll see that a lot of that isn't going to be included in the next draft. But I really wanted to thank everybody's constructive engagement. People came with ideas, concerns, and they were able to explain them so that we have a stronger understanding. And that's where that work really comes in. So I did want to touch on rule petitions. We do get a lot of those and we don't always accept some of those. And some of that's based on resource implications as well. Because again, right now we have one of my permanent rule folks out on paternity leave, and he'll be back in October. But it's really putting a barrier to completion of some of these in place. And so when we look at the rule petitions that come in, there's definitely a resource implication that we have to be considering. And I want to encourage folks to reach out to us before, because if you have an issue, it may not necessarily even need to go through the formal rule petition process. We may be already working on something. We have an internal rule request type of a process now for the agency, and we're looking at opportunities to pull some of those fixes that are needed into other rule projects. So if you have something that you're exploring, please reach out to us and we'll be happy to walk through that. Doesn't mean you should file a rule petition, but we may be able to help with some of the challenges in the interim. So please feel free to do that, and I'll be happy to answer any questions later.
Thanks, Justin. Now we can turn to Dr. Sarah Oki, update us on research.
And I get the microphone. Good afternoon, everyone. Pleasure to be here. I was not around for the original Alcohol Advisory Council. So happy to be here for the reinstatement. My name is Sarah. I lead the research program. The research program was developed 2 years ago. So the research program is relatively new, and we were developed to help further extend the agency's commitment to make data-informed decision-making. And the agency recognized that building out a team with subject matter expertise in research and analysis could help, again, help the agency make better data-informed decision-making. The research program works to be a nonpartisan and transparent resource focused on public health and safety outcomes related to products, policy, and regulation of alcohol, cannabis, tobacco, and vapor. And our work really centers on our day-to-day around LCB's mission of safe communities, increasing data accessibility and responsiveness, and having a culture of trust and belonging through our research. We're a really small team. We have 3 people. And somehow we strive to be a resource not only for all divisions at LCB, but also for state agencies in Washington and outside of Washington, and with academics, because we're all research scientists through and through. I'm a research psychologist, and we really value the scientific method. We really strongly emphasize good research. And by that, I mean, we want to ask questions, analyze data, and then share out what we find, whatever it is that we find. And if in any way we would not be able to do that, then this research program would not be able to succeed. And I am unbelievably so happy that our agency and our leadership and every single director here, from my direct supervisor, Director Nordhorn, Becky, Larry, Mark, everyone here, all the way to Chair Bollendroff, has been so incredibly supportive of that statement. And this type of research program is pretty rare, particularly in a regulatory agency. And so if the first kind of highlight that I want to give is just increasing awareness about this research program, the fact that we are producing this good science using the scientific method, and sharing out science is really unique. And we I'm looking at you, Kristen. I know you're next after this agenda, after my agenda item. Kristen, our public health education liaison, does a really great job at helping set up presentations and showcasing our research program in public health with our public health partners. And we'd love to do that more also with all of you too, of sharing our work with you all too. A little bit more about what we do. So first we do data briefs, research briefs, and peer-reviewed publications. So both on the technical and non-technical writing for different audiences. So examples of research briefs that are like within the non-technical audience for alcohol include impact of BAC driving limits, alcohol common consumption limits, alcohol use in sporting events, alcohol use, nightlife, and sexual violence, alcohol product placement in retail outlets, and alcohol outlet density. Those can all be found on our research program website. Going to what Mark, you said, almost all of those research briefs conclude with data is limited, we need more research. And I know when our rules team asks us question, or when Becky, you've asked us questions, a lot of the times the questions are very, very specific. And with research, it can often be like a little bit over here, as opposed to when you want a data-driven question, we want it to be like very specific over here for like a legislative ask or a rule ask. And so sometimes it's really hard and you have to make informed decision based on the data that is out there. And I'll get to my point after I also talk about the dashboards and research evaluations that we do. So the dashboards that we currently have out that are related to alcohol are liquor sales, revenue, and distributions. And then also our youth access compliance checks, which you can easily see how liquor stores compare to cannabis and tobacco and vape. And then right now we're also working with our license and our enforcement education division on a pilot evaluation or pilot project for increasing handmade cocktails in general sitting at the sport and entertainment facilities. So coming back to our need for data, and Mark, you just, I mean, you teed it up so nicely. We didn't coordinate this, but our mind is we're on the same page here. We're always seeking more data and more comprehensive data. Again, with good science, we're seeking different perspective data that is comprehensive, that tells the full picture. And if you don't have data that tells the full picture, you get a story that might not share that full picture. And so if you have data and you're willing to work with us, or you're willing to talk with us about it, come contact us. We are data nerds. We love to talk about data and hear about data. We are also working on different surveys. So if you have different recruitment channels that can spread the reach of surveys, we'd also love to talk to you about that as well. So with that, I'll pass it off to Kristen.
Thank you, Sarah. Before I move on to Kristen, I did want to point out that Sarah mentioned these meetings, the cannabis and the alcohol councils are a supplement really by the roundtables that we conduct. We will continue with the research roundtable. I was able to participate with, sit in on anyway, the research roundtable Sarah did earlier this year. And in October, I'll be joining Kristen for a healthcare update. Anyway, Kristen, you can tell us more about that, but Kristen Haley, take it away.
Let me just make note to tell you about the roundtables because I wasn't planning on it. Thank you, Pete, for keeping me honest. So hi, everyone. Again, I'm Kristen Haley. I'm the Public Health Education Liaison. I've been at the agency for almost 2 years now. Before I came to LCB, I spent about a decade at the Department of Health. I'm a trained health educator who specializes in two kind of distinct areas. One is social marketing, which is the study of behavior change science, study and application of behavior change, and then also prevention science. And I think a lot of times when people hear folks in the field who specialize in prevention, they assume that means like abstinence or just never starting a substance in the first place. But it's a much more of a spectrum in prevention. So that can include folks who are using substances moderately, and part of my role is helping them do that with harm reduction tools and strategies so that when they use, they're not harming themselves or the people around them. And then it can also, that spectrum can also include folks who maybe are struggling with substance use, maybe struggling with substance use disorder and need access to treatment and resources. And so prevention for that population is preventing further harm or further use. So I bring that up because I am on a lifelong mission to help people understand, when you hear people talk about public health and prevention, it's not just, making sure that we like eliminate all substances. I won't say that there's no one out there who thinks that, but that's, we're not a monolith. And so my role at LCB is to really try to wrap my arms around all of the different parts of prevention science and make sure that that voice is being heard in the work that we do here. So the way I think about my work, it's sort of categorized in 3 different buckets. First, I advise and consult with our partners in prevention and public health. And that could be across a number of different state agencies doing work on campaigns or research, like with the research program or other academic institutions across the state or country. There's also a lot of work happening on the coalition and community level with programming, and often I'll get tapped to advise those programs or to enhance their program in some way by connecting dots to LCB. So that's one bucket. My second bucket is that I think of myself as like a convener of partners and stakeholders. So here's my plug. We do roundtables, as Pete mentioned. And one of the purposes of our roundtables is to bring our partners together in kind of a semi-structured formal space to talk through specific topics that we want to gather their feedback from, and to also create a space, hopefully, if we're doing it right, where our partners feel like they can be more candid and honest with us, and they can bring a gripe, or they can problem solve with us, or they can say, hey, LCB, we love everything you're doing and well done. Sometimes that happens, but mostly it's a space where we can work through things with our partners in kind of a controlled environment where they feel like they're more seen and heard. And then, and I also want to point out, if like Pete mentioned, that's not just with public health and prevention. So I'm the health education liaison at the agency for all of the constituents that we serve. So it's not just a bridge to the public health field, but also to our stakeholders in alcohol, cannabis, tobacco, and vape. And then the third area is that I'm the liaison, as my title says, between public health and prevention and LCB. So as I was listening to all my colleagues before me today, I was thinking, oh, I help with that, and I help with that, and I'm integrated into that. And so you can just sort of put an asterisk across everything you heard from everybody else and just assume that I'm at that table and I'm informing that process and trying to bring the public health and prevention voices, both from my trained expertise, but also if I don't have an answer, or if I'm recognizing that, like 1515 is a great example. It's just so big, and it's not something that I can be a singular voice on. And so then I go to my partners and I say, what's the group thinking here? What are we thinking at coalition levels? What are we thinking across other state agencies? How do academic institutions feel about this? What's the research say? And then I coalesce all of that and bring it back and inform our divisions or our rules team, our agency leadership, the board, as they're making decisions. So I think that liaison, whoever named this position, got a spot on, because that liaison piece, I think, is really accurate to what I do. And then when I bring all of that together, I do it with the purpose of coordinating and providing recommendations for policy work that, Mark leads with, bills that we see come across our desk in session. I try to be the voice that says, here's my take based on my expertise, but also here's what I'm hearing in the field. So during session, a big part of my job is just being on the phone constantly with people and assessing where they're at, where their agencies are at, where they're going. Sometimes people say, my agency isn't sure where to move on this. Where's LCB at? And then I say, I don't know where LCB is at, and I figure that out, and then I go back to them, and then we try to move together. And sometimes that happens with external stakeholders, including folks in the cannabis and alcohol spaces. And then same thing with rule development. I'll talk about that a little bit more in a second. A big part of my role is sitting in on very long rules meetings. Sorry, Justin, they're just so long all the time. And I jump in with, hey, have we thought about this? And sometimes it's poking at something. Sometimes it's making sure that we are honoring our agency mission to uphold public health and safety. So my priorities, I thought it might be helpful for you all within the alcohol space to just know like what's my mind on in 2025. Obviously the big one is 1515 rule development. I think Justin walked through that enough, so I'm not going to get into it, but I will just say in those meetings and when looking over the drafts, my role is trying to infuse public health and prevention best practices where we can. The window's pretty narrow on that bill or that rule because the bill was so prescriptive. And so a big part of my job isn't necessarily rewriting or trying to change the way that it's written, but instead helping our public health and prevention partners understand that bill. I get a lot of calls and emails saying, hey, we don't understand it. And I'm like, it's a very confusing bill, and that makes you a normal person because we're all trying to wrap our arms around it. And then also trying to help them understand this is where this narrow scope here is where we can inform and enhance public health best practices. And here's where we can, and here's why we can't. And then also being mindful, like if this is an issue in your community, how can you be doing evaluations and monitoring in your own local kind of community mobilization to make sure that the way that this rolls out at the community level is keeping everybody safe and, honoring the intent of the bill, which is to expand the alcohol service. With alcohol product placement rules, I see my role as listening, learning, and compromising. We did a ton of calls with alcohol industry folks and a ton of calls with public health folks. If I had to offhand, it was over 12 different individual calls. And my role was to just stay right in the middle of that fence and to listen to everybody's concerns and then go back to the table with the rules team and with Justin and try to find compromises that made everybody feel good at the end of the day. So hopefully when you see the next version, you can see that we're trying to honor that we've heard, the very real constraints that the first draft put on alcohol industry folks, and then also the very real anxiety that some of the public health folks raised. And so I think that the next draft you're going to see is going to honor that. And that's a big part of my job, is just making sure that we're weaving those things together. I always try to make everybody happy and everybody mad at the same time. I think if I'm doing that, I'm right there where I need to be. My next thing is with that I just want to be sharing with all of you, just so you're situationally aware that this is a part of my job. The Washington Traffic Safety Commission convenes something called fatal case reviews. So they bring together partners from many different state agencies or coalitions and advocacy groups. Enforcement, judiciary folks are there. And the purpose is to analyze, do a deep analysis in a stack of fatal cases for driving impairment or driving impairment related crashes. So sometimes the substance that we're exploring is different. So sometimes it's opioids, sometimes it's cannabis, sometimes it's alcohol, sometimes it's a combination. So that factor changes. And then also, you know, sometimes let's look at just young men with cannabis, or let's just look at not wearing a seatbelt plus alcohol plus men plus this age range. So we narrow down the data based on a number of factors, and then we read everything there is to read within their case files. Usually there's about 12 to 15 different cases, which is for each one of those like hundreds of documents. And then our group of folks, which is about 15 or 20 of us across multiple sectors, get together and say, what did we learn here? And we try to find themes. And the reason I raise this for all of you is we do it once a quarter, and we find system solutions based on what we're seeing. And sometimes those system solutions then spark project ideas for us at LCB or for some of our other agencies where you all might end up getting tapped in the future. We have a project that kind of sprang out of that around place of last drink, where we identified there was a theme that came out of one of the fatal case reviews that if we could tighten up the system that we have for preventing future overconsumption, by using place of last drink as kind of a model or a system, we could potentially save lives. And obviously folks that are doing the alcohol service play a really important part in that. And nobody wants to be part of a fatal case situation, right? And so I think there's a real potential opportunity for state agencies, LCB in particular, to partner with folks across the field. So I will be keeping you all in the loop and bringing you all in the future as I see those system change opportunities come up. And we don't want to make systems changes without bringing the stakeholders to the table to have that conversation. The last thing I will just highlight is the Healthy Youth Survey. Some of you might be aware of that. Mark mentioned, you know, the massive gaps that we have in data in our state, especially around alcohol. One part of the story that we do understand is our youth use rates, where they're getting alcohol is asked on that survey, their perceptions around alcohol, their use rates, obviously the types of alcohol that they're using. And, you know, we have the opportunity, because LCB is one of the 4 agencies that runs the Healthy Youth Survey, we have the opportunity to inform the types of questions that are asked. And so that's another area I see us potentially being able to partner in the future. If there are trends that you're seeing in your field, or there are gaps in the knowledge that you think we could enhance, that's an area that we have some control over. And we're always all ears for folks to weigh in. And also, if you want to know what is happening in the youth space for alcohol use, we would be happy to make sure that that data is available. And that is it.
Great, Kristen. Thanks so much. I'm going to note that we're really well ahead of schedule, which means, of course, there's a lot more time for our guests to speak their mind, let us know what issues they're concerned about. But before I go to our agency director, I just wanted to get that little point in there. If any one of our prior speakers had anything else to add, did you think of something that you wanted to say and overlooked? Because we were very concise. All right. With that, I'm going to pass it on to our excellent director, Will Lucella.
Well, I appreciate that. Good afternoon, everyone. Will Lucella, the agency director. I've served as the agency director for the last 2 years in Washington State. Prior to coming to Washington State, I spent 31 years in the state of Colorado in different industries, liquor, gambling, and cannabis. So marijuana in Colorado. I'm going to be brief. I mean, I think you've heard from staff about how busy they are and continue to be, as well as myself. I can tell you, between the legislative implementation and leads, we've stayed incredibly busy. So again, I'll echo Becky's sentiments. Thank you all, especially on the liquor side, for your patience and understanding as we work through some of the challenges that come with implementing a new database. We'll get better. We just need a little bit. So I also wanted to thank everyone for their participation in this advisory council. This is my first one, and I really do look forward to the discussions and getting to hear what's important to the industry. So with that, I will stop and I'll turn it over to Pete.
Thanks, Will, and thanks for all of the agency speakers today. Now it's time to hear from the industries we regulate. So unless there was objection, I was just going to take them in the order listed on the agenda. Have we heard from Andrea? Okay, so moving on, Jeff, you're first up.
Thanks. As of right now, we do not have any issues that we're looking at bringing proactively either to the board or to the legislature in 2026. We would just offer that as it relates to our industry, we're in a pretty volatile environment. As you kind of noted, there are changing preferences and there's changing structure within the various business organizations that operate in our sector. So we just appreciate the LCB continuing to have these, reaching out to us and being able to listen to stakeholders as it relates to how we continue to navigate the ongoing changes both in the industry and in our state.
Great. Thank you, Jeff. So, Paul, if you're still online. Paul
I am,
Beveridge?
thank you.
Okay.
Can you all hear me?
Yes.
Great. Well, it's wonderful to be back and hear from everybody. If you don't know, the wine industry is in the biggest slump in 50 years. So it is brutal out there right now. It's all affecting all aspects of alcohol. But we've been predicting this for a while, and we've run some tax bills to try to lower the tax burden on small wineries. We've still got a bill alive that we're working on there, but we are seeing the bloodletting. We are losing wineries almost daily. Very sad to see that two of the biggest and best women-owned wineries in the state just closed their doors and auctioned off all their equipment. I think we're probably under 1,000 wineries in the state now. Oregon now has more wineries than Washington. So we're trying to help the little guys. One thing that'd be very helpful in terms of research and something that Mark has helped us and the finance folks have helped us before is tracking the number of wineries that are going out of business and also the number of wineries that may not be out of business but aren't paying any taxes anymore. So they're essentially out of business. And so we'd love to get that data updated this fall before we go back to the legislature. We also got really nailed by the fee legislation. The fees we pay for our licenses, a small winery pays the same fees as the big winery, does. Right now, at last count, my tiny little winery's got 17 licenses. That's a lot of fees. So simplifying that licensing structure and reducing that fee burden would be really helpful. And it would have the side benefit of making all your websites and computer programs run more smoothly if there weren't quite so many categories. Something we've always wanted to work on. And then the last thing I was just going to suggest is some reading for folks. There is a great book out by a retired BBC science reporter, and it's called The Very Good News About Wine. And I know if you read in the paper these days, there's this idea that no amount of alcohol is safe. But what this guy did is he looked at all that research, and then he looked at over 1,000 peer-reviewed medical journal articles about the benefits of moderate consumption of wine. And his conclusion is that wine is still good for you. And it's a great short book. I think it does a really fair job of looking at all sides and looking at all the relevant research. It's a short read, and I highly recommend it. The Very Good News About Wine. Thank you.
Thank you, Paul. I saw Sarah busily writing down that book title especially. Okay, Mari, are you still on?
I am. Sorry, it took me a second to unmute.
No worries. Thank you.
So I represent the distilleries in the state. And, I think echoing what Paul said, I think that pretty much probably the breweries are going to get on and say the same thing. And the distributors are going to get on and say the same thing, which is, we're in a really tough time right now for the industry. It's impacted at every level, on and off premise, at tasting rooms, through the distribution channel. Pretty much everywhere is getting hit, and it's a combination of factors. Partially the health conversation, I think, partially the economy. I think we all kind of know what's adding up. But I would just say that, for the last 5 years, really, this has been a really tough business to be in. And we've been in business personally 14 years. I would tell you this last 8-month stretch has been one of the toughest we've ever seen. And we're looking towards LCB, I think, to be a voice of moderation overall, and a voice that is not encouraging the use of alcohol, but not discouraging the use of alcohol, and understanding that this benefits all of us if we can encourage responsible consumption and responsible regulation. That's kind of my 2 cents. It's like Paul said, every day we get a new auction email with a distillery that's up for auction. So I think we're about to see what is really a seismic change in the industry overall, both all beer, wine, and spirits. That's it.
Thank you very much. Oh, I'm sorry. I skipped right over Scott Hazelgrove.
There'd be some people in the room that would appreciate that.
I'm so sorry, Scott.
Not a problem. So thank you. On behalf of the distributors, I never get to say this, but I agree with Mari. I think that it is interesting because the public perception of consumption and the actual consumption numbers in Washington State don't line up. And I think it would be incredibly helpful for you all as the LCB with your research capacity to simply share that information. Not arguing whether it's good or bad, but helping people understand what does the market look like, both on a per capita basis in consumption, but also across the board in consumption in both wine, beer, and spirits. And I think people will be surprised when they look at it, though folks in the industry, quite honestly, are not so much surprised, but really concerned, because I think it does threaten especially a lot of small producers. On this same vein of research, last year the legislature debated a bill that was ostensibly a study of alcohol taxation. There are lots of different editorial comments that could be offered about that bill and why it was introduced and what its purpose was. But what struck me is that many of the questions that bill asked for a study really would require information that is already readily available out there. And I think the legislature simply did not want to make the effort to package up the materials that are already there. We tried to offer it up a number of times. Shockingly, the legislature didn't always believe that data that we were offering as beer distributors was indeed the accurate data. But I'm happy to work with all of you because I think ultimately having that data out there will help inform these decisions. And the questions about alcohol taxation, and I would argue cannabis and tobacco taxation, are probably not going away. And so having a baseline at least of, okay, you had some questions out there. Different people had different questions that were incorporated into that bill. Is information already available? I think it is. It'd be hugely helpful for the LCB to really serve as an independent third party to be able to offer that up. Continuing on displays, I want to congratulate the agency as a whole, Justin in particular, and even the chair, who I know has a passion for this issue. But the issue of displays is a challenging issue, obviously, for the industry and for public health as well. And the way you all went about engaging and kind of floating and then discussing and understanding really harken back almost to the time of COVID, where we sat down and tried to say, okay, what are the essential goals that are out there for both industry, but also for public health? How can we accommodate those goals? And maybe how can we think creatively about getting to a place that will make improvements on both sides? I feel like that kind of mentality was brought again to this proposal. So I'm excited, maybe some trepidation to see what this next draft looks like, but I do think there is room to really move forward on it. We may not agree on everything, but I think there's been a good opportunity to be heard and discuss, and I hope that opportunity continues. Let me throw out an encouragement, I guess, and this really has to do with enforcement. And it's kind of surprising somebody from the regulated side of the industry would argue that we should be looking at enforcement. But I think there are concerns. If you look at a lot of the current litigation, the recent litigation against states challenging their ability to regulate alcohol, challenging their ability to require licensing, challenging their ability to limit sales, a lot of that litigation has ultimately gone back to this question of, is the state actively enforcing the rules it has? Does the state have a lot of exceptions to those rules that basically make it a piece of Swiss cheese? And if so, the courts seem more inclined to drop that legislate or drop that state regulation and overturn it. I want to encourage the LCB to really look at enforcement, especially in our universe, in some of the trade practices areas, but also the non-retail enforcement, to take a look at how can the state take action to really build a case that it is effectively working to defend its rules and its regulations. And as an example, I think the issue of Washington consumers purchasing alcohol from unlicensed out-of-state sources, especially online, is one of the areas where, quite honestly, we struggle. We've already seen some challenges in court recently. It would be, I think, helpful to talk about how we can enforce to ensure that those laws are accurate, that we are providing protection. I think people would generally say, and I've heard friends say, well, I don't know why I should be able to just go online and buy it. And what they're missing, because we do have a relatively safe system, is they're missing the fact that they have no idea where that alcohol came from. It could be counterfeit. It's not really an issue here, but even in Mexico, we've seen a number of stories of counterfeit alcohol causing huge health problems and even deaths for Americans who are visiting. The question is it stolen? We're seeing a growing problem with retail theft, and we're seeing huge challenges, I think, for the retailers in being able to enforce. Is that alcohol being purchased online actually coming from alcohol that was stolen or not? I think there is some renewed importance in thinking about why we have a licensing system and why we don't simply allow anyone to sell alcohol anywhere, anytime, which I know some folks are advocating even as recently as the last legislative session. So I hope we can work with you in thinking about kind of what those pieces look like. And also, quite frankly, in making sure that the agency as a whole, from the board on down, understands the legal underpinnings that justify your regulation of a substance and make regulation of alcohol different and unique by the state than it would be for another common problem or product.
If I could comment on that, keep your eye out. We haven't seen any drafts or anything, but there's been a lot of action last year, actually over the last probably 5 years, around internet sales and even particularly around vapor products and tobacco. So some of the same commerce impacts are going to be brought, I think, to the legislature for consideration, that if it does deviate from what we have in the alcohol space, then that's going to create risks within the alcohol system as well. I mean, if the state does take a policy position that's different than what it's currently done for alcohol, I think that those challenges that you're talking about could certainly be have different outcomes.
And I appreciate your comment. We actually had a brief yesterday in caucus about the same problem, but with THC products, hemp-derived THC products. So I think it is a growing concern. I think the counterfeit concern, the youth access concern, and then the piece on unlicensed establishments and where they're providing that and to who is something that we can always look harder at. But I definitely appreciate those sentiments and look forward to hearing them.
Fantastic. I will say, my members may not always agree with this, but I'm thankful that the state has been clear about its line on no sale of hemp-derived THC products. As you all probably know, if you follow nationally, this is a huge issue, an incredible brawl in multiple different states. Being able to simply say, it's not an issue in Washington, it's not an issue in Washington, it's not an issue in Washington, actually has freed up a bunch of my time to do, well, alcohol tax research. So that alone is good, but thank you.
Thanks, Scott. I know in my ride-alongs, this has been a subject, minors in possession, for instance. I was going to ask Justin, is 2260 from 24, there was some legislation, Senate Bill 2260, and we've been talking, it's the idea of civil penalties for minors in possession.
That was civil penalties for those furnishing. So for a store clerk.
Yeah, right.
So that was an agency request.
Well, that's, and that's the discussion that we had with enforcement, was coaching, but anyway, let's go ahead.
Yeah, the civil penalty issue was something that we offered for that sake of consistency, because, you know, we have 39 counties and they all do things slightly differently. You know, Seattle district court's jammed. So having a minor in possession issue or a furnishing to a minor does not usually take priority. And you get some of the smaller counties, and we've seen, you know, days in jail and $1,300 fines. And so just the inconsistency is problematic. So now, you know, for those clerks who are just simply making a mathematical error, are we going to have to go down the criminal road? We have another option now, which I think hopefully will improve the compliance rates down long term as well.
And at the risk of beating a dead horse on online sales, I think people have asked the question, really, how often are kids ordering alcohol online and having it delivered? I think what they are missing is that there's a general willingness to ignore the rules we already have about delivery of alcohol. And sadly, especially in some major urban areas, theft of packaging is pretty common. So if somebody leaves a package that says it's alcohol, must be 21 years or older, and it's sitting on the front porch step, you might as well just put up a flag to the kids to say, come and grab it. And I think that pathway to minor in possession gets missed in some cases when we talk about online sales and delivery.
And I think there's an educational aspect, right? For our peer law enforcement agencies, there's an educational aspect for some of the municipalities and for a lot of the other industries that we can share as well. Enforcement is probably the last rung in the ladder as far as minor in possession. On the education and prevention side, letting them know that it's out there and that it exists is something that we can do. And it's also something that my officers and my compliance consultants can do with law enforcement agencies. So
great. Thanks.
I did want to mention back when we were in COVID that that delivery was a huge issue.
Yeah.
And so we actually here at LCB addressed that with, you know, with some of these regular, and I'm not going to say their names, the folks that were doing the delivery, and you know that we wouldn't allow for them to do delivery in Washington State because of the number of violations they had. So for some of these folks that were doing delivery, they definitely cleaned up their act. That it is something, you're right, at the national level, we have conversations about it quite often about, you know, that how do you make sure that whoever is delivering that alcohol is over the age of 21, has ordered that alcohol, all of those things for some of these businesses that deliver are in place. But I'm not saying for everybody, but I am saying that there has been a big push nationally to make sure that that's happened.
we did lose those positions this year. So we've absorbed that work into our regular retail work, but we're always looking at ways to continue to expand it.
I have two things, and I'll actually pass the second thing off to Kristen. First, on one of our dashboards, we show delivery compliance rates So you can see that on our dashboard, youth access compliance rates for overall compliance rates, and then delivery and curbside for when that was in effect. And then Kristen and I have been working with researchers who actually have been looking into young adult delivery and their behaviors. Kristen, I'll let you describe that a little bit more.
I like that we're at the part that I just looked at you and you and I both knew that we were going to talk about this research. It's kind of a new level of a relationship that's unlocked there. I just wanted to flag, because of this conversation today, and then also, a lot of folks have talked about these research gaps, that there is a national study that Sarah and I, on behalf of LCB, are both advisors on, and also helping with the recruitment, and will help with the dissemination of the data. That study is recruiting young adults who are legally allowed to, I think like 21 to 25 is the range, in I think 5 different states. And then their goal is twofold. One is to measure, like, when I've ordered this from whatever means, whether it's a restaurant or bar or like some random source online, am I getting carded? Are they just leaving it at the door and walking away? Like, so they're tracking all of that to measure nationwide, at least in those 5 states, what is the prevalence of this happening. And then the second part is also maybe less relevant to this conversation, but I'll just share it. They are then following along with the folks that did the order to see pre and post ordering online if their advertising from alcohol marketing is increasing. So then we can all better understand, like, how are those bots being used to then, and then they're measuring whether those folks, after receiving an influx of advertising, are then ordering more alcohol, which is more interesting to us than probably you guys, but maybe it's interesting to you, but in a different way.
Yep.
But because it's also across states too,
yeah,
we'll be able to see different policies and if there are changes.
And if there's protective factors in place, or if the lack of those policies is increasing the use of alcohol. So.
And when do you anticipate that study will be?
So that study got folded into the federal government budget cut stuff. And so they have been on pause and will hopefully unpause at some point. They got a partial grant and they started up and then they stopped again. So yeah, it's part of that whole thing. Was there anything else you want to say?
Okay, great. Let's add Daniel Olson's voice to the conversation.
Sure, thank you. I'm gonna echo what the wineries and the distillers are saying. It's a pretty tough landscape for our craft breweries here in the state. We're seeing hop harvest is going to be a little lower as it has been the last couple of years. I think also in the last couple of years, we're seeing more brewery closures than openings, which is a first in about a couple decades. And so really struggling out there in the brewing space. I will say we're encouraged with the general overall House Bill 1515 and allowing some of our breweries a little bit more flexibility to get in front of consumers, and also looking forward to working closely to implement House Bill 1602, which also provides a lot more flexibility and lower cost of entry for breweries that are looking to open a second or third location and not necessarily wanting to run a kitchen theirselves. So appreciate being here today, and looking forward to the next chance for all of us to connect.
Thank you. Thank you, Daniel. Carolyn Logue, I still see you up there, so let's hear from you.
Yeah, I am still here. So Carolyn Logue, Washington Food Industry Association. First of all, appreciate the comments that were made by Scott in terms of online internet sales, and also the comments from the industry folks on the challenging times for business right now. The grocery industry is seeing the same thing. It's very difficult. And that's why, once again, alcohol sales are important for us to make sure we're doing it right, because they sometimes can help keep a store open in a neighborhood. They help us offset some other costs. So it is important. But from our perspective, no issues. We can't think of anything we need to actually want to see done this year in this session, understanding the budget. We would like to engage in some broad internal conversations with the liquor board on license fees and kind of the response to the fee bill from this year, and how we maybe could come forward with some proposals that could change how that's done and look at some modernization. And then also really appreciate the work that's been done on civil penalties for minor possession. It's making a difference for our stores.
Thank you,
And we
Carol.
are looking forward to the next draft of the product placement.
Great. Thank you. Well, Sean, you're next up.
Thanks for having me. I know a lot of you get to work with our incredible members, and they probably are always very kind. But I will say, every time I hear a member complaining about the LCB, it's about the ruling you make, but not that you didn't get back to them. Many times it is our members that are at fault. So I just want to thank you. You engage with our members. I hear from you. The timelines might not often work out for them, but I can't always say that's on the LCB. So I want to thank your team. They were supportive of the hospitality industry. I also want to thank Mark. He was a pleasure to work with. He helped me understand, and the rules committee as a whole, very responsive. The hospitality industry, like others, is facing tough times, especially with the decrease in tourism. I think a lot of us are seeing that. So we are looking at how the restaurant and lodging models are going to be changing over the next few years. We are anticipating significant closures coming down the pipeline. So that is just something I want to flag. A lot of them are unexpected. A lot of these restaurants don't have a chain of someone to take over afterwards. And that's another thing that's kind of come to our attention. So with these changes, we are hearing the word modernization a lot in this meeting. 1515 is titled Modernization in Alcohol. It's not expanding access as we see it. It's increasing opportunities. So as we look towards what's going to be changing in the hospitality space, how are we meeting people where they are today? 1602 is focused on microbreweries, perhaps something that's in the future, not this upcoming session we won't be looking at, but how can food trucks meet the demand of where folks are? We know young people are going out and drinking less. We have a data team, Sarah, I'd love to connect you with, so we can be a mutual resource to our 6,000 plus members to see how we can meet these needs as industry evolves with data, so we can go comprehensive solutions. I think a good example is we had a member who they got the answer they were looking for. Maybe they didn't want it, but they could meet the needs by taking the wheels off of a food truck. That we're not going to address at this session, but that shouldn't be. I don't know if that should be a long-term solution. But how can we partner in the future to rules that make sense? You're good over there, Brad?
Okay.
And then the other thing, Larry's department, the enforcement, I love the consultants being brought in. A lot of our members just, they don't put 1, 2 and 2 together. So your team being able to connect those bridges with the soft helping hand, and then tougher enforcement when needed. A lot of the complaints I get from our members are areas where our members should have been more vigilant. We're happy to work with them, but we understand there's rules in place. So overall, I think a big part is what is modernization, making our restaurants more modern, getting it out there while keeping public health into account is going to be a lot of the work we're doing. Probably not this session, but in the future, we hope we can work hand in hand for things that we can't solve through rule making.
Thanks, Sean. And you've kind of provided the segue to Brad, so I'm going to push my mic over.
Thank you, Member Holmes. First, I'd like to start off by saying it's nice. The last time we had this meeting, I think there's only maybe one board member who is continuing on. That's Board Member Garrett. And so I think it is worth saying that for the staff members that I have gotten to work with Mark, Justin, and with Becky, I have always really appreciated the relationship that we've had. You guys have been great and responsive. You've always gotten back to me again, not necessarily always with the answers that I wanted, but for the new board members and for the new executive director, I wanted to make sure that you guys understood that you have great staff. And we really appreciate the way that they've interacted with all of us. I want to go on the product placement issue. Looking forward to seeing the new draft. I will once again highlight that for stores whose central focus is the sale of alcoholic products, product placement is a different question than those that are selling alcohol as a subset of their overall. So hopefully the new language addresses some of the concerns that our members felt, and looking forward to continuing to work with you on that. The other pieces that I wanted to chat about are kind of all driven by the fact that Washington State is far and away the highest alcohol tax jurisdiction in the nation, right? I mean, we're 50% higher than the second highest, which would be Oregon. We're double Utah with its, Mormon population. And we have done a couple of the online stings, if you will, on our own. And we've ordered liquor products that have been delivered into state from, say, New York. Well, New York's taxation is about 1/6 of what ours is. So we are very anxious to help you, as Scott had mentioned about enforcement, and try to engage in making sure that everybody's following the rules, because the sale of liquor, spirits in this state is a significant contributor to the overall tax base. And to the extent that people are avoiding that, they are not only damaging us, but damaging all the public services that could be provided with that. To that extent, though, I will highlight, we share a concern with the general retail community, which is that we collect and remit a great deal of revenue for the state. And at this point, about 90% of our sales in stores are credit card sales. And of course, we are being charged 3% on those sales for the privilege of that purchase. About 40% of the average cost of a sale is for liquor tax. So when we are more burdened than other retailers, if you will, because of the percentage of the purchase price that is constituted by tax or fees that must be remitted to the state. If you calculate it, it's basically about a 1% shadow tax on liquor retailers. And we are experiencing the same downturn that everybody else is. I think I heard approaching a 20% year-over-year decrease in overall sales. So we've got a lot of people that are out there hurting. And I'm being asked what the possibility of getting a little bit of relief is, especially if we are talking about relief on licensing fees, just specifically to help offset the cost of credit card processing for the monies that are only going to the state, that are not actually coming to the retailer that we're remitting. So I'd like to maybe talk to you guys about the appetite for that. I realize we're probably not going to get a good revenue forecast in September. I don't think that this is going to be a year that the legislature is going to be just handing out reductions. And but we are a significant contributor to the overall coffers, and a big portion of our expense is related to the amount that we remit. So it'd be nice to have a little bit of recognition of that. I think that's it. That's all I really wanted to say. Actually, it was nice to meet you, Sarah, and Kristen, nice to meet you as well. I did have one question about the research, and just that, again, as Scott said, it would be most appreciated if the licensing agency were neither pro nor con, but rather was creating an environment in which people understood the rules, followed the rules, remitted appropriately. The research that you're doing strikes me as fitting probably more appropriately under the Department of Health in a lot of cases. So I'm just curious what you guys are taking on as research projects that would be specific to the mission of the LCB. And I'm not trying to take anything away from the general public health efforts, and it's always best to be operating on data-driven metrics before making decisions for policy purposes. But the issue of public health is already primarily the issue for the Department of Health, whereas the LCB has it as a different mission. So how do you square what you're doing with what the agency's mission here is, and how much overlap do you see with the Department of Health?
First of all, I think flagging that protecting the public health and public safety is literally in our mission. So there is just that clarifier that while it is the entire agency of the Department of Health's purpose is to protect the public's health, that is also part of our body of work. The other part of your question, I think in my time switching gear, I had to switch hats, right? When I came from Department of Health to LCB, I had to kind of change my vantage point and shift my perspective away from I am like a champion of all things public health to I am now sitting on top of a fence between two different stakeholder interests, those of public health and prevention and those of our licensees across different industries. And in doing that perspective shift, I have realized that we are stronger, smarter, I think more nimble, more prepared as an agency because we have that linkage to public health and prevention embedded in this agency in the work that I do. And what I mean by that is because we are regularly engaging, like meetings like today, our roundtables, I think some folks have called out the engagement that we did with our alcohol product placement rules. Because we are engaging with our licensees, I'm able to bring that perspective back to our public health and prevention folks. And I'll be honest, our public health and prevention folks don't often get to be allowed to talk to industry folks because of all of the reasons we can have a whole other meeting about, but that doesn't get to happen. And so that bridge doesn't exist without this position being embedded in the Liquor Cannabis Board. And then as far as, this isn't the word you use, but like the risk of bias or approaching research with like too much of a lean towards the public health side of the fence. I will just say that is something that Sarah and I are always mindful of. I think it's also why Sarah's program and my body of work are intentionally two distinct things. Like I'm not part of Sarah's program so that the research program can remain unbiased and can remain rooted in that scientific method, like Sarah was mentioning. I do my best, but like I am a trained health educator, and so it bleeds out sometimes. And I think having that built-in protection is intentional and also benefits the interests of not only public health and prevention, but also our licensees. And that Sarah and I, when we build whether it's research proposals or when we are looking at, as consultants on national research, or if we are conducting our own and building survey instruments, we have that conversation. It's like built into our process to make sure that we are not like trying to prove that the alcohol industry has done something wrong, right? Like we're trying to build our research in a way that allows the research process to find the answers wherever they might land. And I think the SEF work that we're doing is a really great example of that. We've been talking with the entertainment facilities about researching with their audience or their participants, whether it's concert goers or sports fans. And we said from the very beginning, like we might land where you prove that like expanding alcohol service was the best idea ever. And actually people are driving less afterwards and there's less fatal crashes and there's like fewer ejections. And like, maybe that's the way this will go. Maybe it'll go somewhere else. Maybe it'll land in the middle. But our goal is to not set out with that research with like trying to gotcha or prove it to our licensees. Instead, we want to make sure that public health interests are infused, but not limit these licensees from being able to, keep their doors open and keep their patrons happy, which is a big goal of that specific example.
Can I add to that? Because I think that where we've been in the past, when we've made policy decisions in organizations that we've made the policy decision, like, no, we're not going to do that. And I think that we've seen in the last few years this organization moving towards, can we do this? Help us figure out, like, help us, Sarah, look at the data that other states are doing. What are other states doing that can help us make an informed policy, make an informed change in our rules? I think that's having these two individuals sit with us has helped us move our rules and policies forward instead of staying back where we've been in the last 5 years. I think that you can see where we would not have allowed for walk around in a sports and entertainment facilities. Absolutely not. We wouldn't have even had the conversation. Now where we're sitting now and like, okay, instead of saying, hey, this pilot looks good, check it off, we actually have some data to support. Yes, they have, that these are all the reasons for us to continue to allow for that walk around or to allow spirits in general seating. Again, something that we would have never considered 10 years ago, wouldn't have even had the conversation. Now we're there. If you go to a sporting event, you can have a cocktail in general seating. It's not like this big taboo, which really does help the industry when it comes to the distributors, when it comes to, well, when it comes to everyone, it really does help in informing these policy decisions.
Member Holmes. Or Ball dropped the question.
Oh, sorry, Jim.
No worries. Hey, thank you. First of all, I just want to say I appreciate the fact that we've created an environment where you can ask this question, because I think it's an important question, and I think it's a great conversation for this group in particular to have. I want to point out that my background is public health and mental health and behavioral health, and that when I was selected for the board in May of 2022, the governor's office and the LCB specifically sought out somebody with my background to serve on the board, recognizing that as an agency, we do play an important part. And I'm really grateful, Kristen, that you pointed out that our mission statement specifically calls out public health and safety as part of our mission. At the end of the day, however, our goal is to help the industry succeed. And if you are not successful, we are not successful. And that's I can only speak as one board member, but I can tell you the tone of the board that I serve on is here to help you succeed. And Becky, your comments, I think, were what I was really ultimately going to get at. And that is that the research for me is really more about being able to make policy decisions that have evidence to support the policy decisions that we're making. And if we're going to implement a program or we're going to try a pilot, we want to evaluate those pilots so we can determine whether those pilots are effective and what are the implications of implementing these pilot projects. And if they're successful, meaning that we create an environment much like we have in the sports and entertainment facilities where we're actually expanding access to alcohol, that we can do it in a thoughtful way and a way that enhances the overall fan experience, et cetera, and increases alcohol sales in those environments in a way that protects young people, make sure that we're doing it responsibly. And more importantly to me is so that we can demonstrate to other states what's working and how we effectively partner with our industry to support the work that they're doing. So anyway, I just really appreciate the fact that we've got an environment where we can talk about these things, and I remain open as the board chair to further conversations around this. The last thing I'll say is that also, it's reflective in the level of staffing that we have in these particular roles, how we right size what our priorities are. Our enforcement division and our licensing divisions are the biggest divisions within the LCB. Our research team has 3 people. Our prevention public health has 1 person. And so I think that is another way in which to illustrate our priorities are based on areas of staffing. The last thing I'll say is that having the research team for me is also important. Like I agree, DOH has a huge responsibility in this area, as does Department of Licensing, as does the mental health and substance abuse communities. And so our intention is to work closely with those other state agencies and not just look at our data in isolation, but look at their data in combination with our data so that we're actually telling an even deeper and richer story about the work that we do collectively as a state. So anyway, I appreciate your comments and just wanted to share my perspective around the research and prevention work that we do.
Thank you, Joe.
Kristen, I was going to talk and then you put your finger up. Okay. Yeah. Great question. And I won't repeat what everyone else was saying. So I'll just expand because I love what everyone was saying. A few things. All three of us that are currently staffed have public health backgrounds. So my background is in clinical psychology. Our research specialist has a background in public health and environmental health. And then our research analyst also has a background in psychology as well. You know, we have a small team and there are a lot of questions that deal with economy and economic. And, you know, I think in an ideal world, like, would we have more expansive expertise that could have more broad-based questions? Yes. And in fact, a couple of years ago, there was a legislative ask related to cannabis and what the number of retailers and producer processors based on a very economic driven question. And we hired a contractor with that economic expertise to be able to answer that question. So I hear you when you look at a lot of our research briefs and it's very public health and safety oriented. And that's a lot of our questions that we get asked are very public health and safety driven. And that's part of the reason why our mission statement on our homepage is public health and safety outcomes related to the products and policy. One of our problems too that we face is that when we go into the literature, a lot of the data that we find, it comes out of like academic research, and a lot of the industry data is proprietary and very, very restricted. And that is honestly something that I would love to work with you all on. And that's part of the reason why I came to work here and why I'm so honored to be in this space that, again, like a lot of researchers in a regulatory space, because I understand that there is a lot of proprietary data, but having the connections where, you know, we have public health data and, you know, a lot of academics have data, but being able to bridge that gap and have this more comprehensive story, being able to connect with your data team, I think would really be absolutely incredible. So yes, I hear that, and I'd love to talk with you more about that. In terms of other data that really kind of go with missions that are not directly, I'm going to go into cannabis a little bit more. We're working right now on a legislative report to look into a social equity in cannabis evaluation. We also have done some surveys that have looked into like potential traceability or bud tender education needs. And then because we love data, we've been working with IT and others from across the division of figuring out how we can better develop more systematic approaches within our agency to be able to increase our transparency and our accessibility and our responsiveness, again, with our mission of the agency, so we can have better data for everyone and can, again, make better informed decision making.
Okay. Oh,
If I may, one of the reasons for the question was because I do think, as I mentioned, and as Scott mentioned, bootlegging is happening and it's going to happen anywhere that you've got a significant price differential. We come up with anecdotes, and I realize the limitations of the LCB in terms of enforcement, but in partnership with the Department of Revenue, if they had a solid academic assessment of which states were the sources of the greatest amount of bootlegging, are there different proprietors that are going? Those are the kinds of research questions that I would hope that the LCB could take on, so that we wouldn't just be coming to the legislature, DOR, and LCB with anecdotes about what's happening and asking for action based on anecdotes. So thank you for the answers to my question.
Yeah, I think you're just hitting the nail on the head with that explanation, though, because one of the things that we find, and we have in the past, having been here so long, we would get feedback from our other stakeholders in the public health space. But depending on where their funding is, for example, they may focus on one specific question and answer that is going to represent a very small slice of the pie, right? And we're trying to balance policy and how we can, have efficient sales. So we're in a better position to ask a generalized question that can be neutral in dynamics instead of a research question that is driving towards a potential assumption. And I'm not saying that that happens all over the place, but we've seen that in some of the spaces. If you're looking at a particular point for youth, for example, then the focus is on youth and the outcome is going to be for youth. But we may be looking at something a little more broad-based, and that gives us the opportunity to navigate. We don't get the data that we want without that level of expertise. So I think that's where the real benefit can come in for us as well, having folks in these positions.
I think lastly, probably the dog pile on the point. You make a great point about at the enterprise level bootlegging, but it's also happening in the communities around the state, and it impacts your businesses as well. The enforcement officers working closely with Sarah or working closely with Kristen, we're able to provide feedback real time to some of the broader law enforcement partners. We're able to provide that feedback back to the industry. And then instead of making enforcement decisions that come down heavy and actually negatively impact these industries, like the board chair said, we do hope the enforcement activities build the health of the industry. There are going to be licensees that we do need to deal with, but it's a very small percentage. It's usually less than 2% that are actually a licensee that an enforcement action would have to impact. Most of it is about regulation and compliance in the health of the industry to make it easier for you all to be able to do the business that you want to do in the state, and then be able to provide those tools and data back to folks so we can inform our greater communities, because there are law enforcement communities, there are prevention communities who come to us where our work overlaps, and we're able to provide that help for them. So it's been a plus to have public health and have research here, because it does make for some more informed processes, and hopefully in the future with our enforcement officers, it does the same thing. It's a great question, like you said.
And I know we're tight on time. I'll just say one 30-second thing, Pete.
Okay.
You reminded me of another point I wanted to make earlier, which is that I have learned in this role, because I am at LCB and not at some other public health entity, and I have access to industry folks who share anecdotes about what their members or licensees are experiencing. That paints a better picture for the public health folks that sometimes have, this like rigid idea of what a best practice is, and they don't realize what that looks like in application. And a really concrete example is the mini bottles element of the alcohol product placement rules. We heard the reason the first draft looked the way it did is that we heard a ton of feedback from public health partners saying, you're in line at the store and you see the mini bottles and kids can grab it, or people aren't paying attention or whatever. And then we overwhelmingly heard from the alcohol licensees, no, like we put it there on purpose, y'all. Like this is a theft prevention strategy. This is the best practices in our field. Like this is how we did this on purpose. This wasn't just like a flagrant misplacement of product. And I think being able to then turn around to my public health partners and say, we overwhelmingly heard this feedback and I changed their minds so that now they stop harping about this piece and are focused on other pieces that are more beneficial to everybody. And that was part of that compromise that I mentioned earlier. So we see that a lot in both the alcohol and cannabis spaces. And I just want to have you keep sharing those anecdotes because I think it helps us make better informed policy. Okay, Pete, I'm done, I promise.
Great. Thanks, Kristen. I'm really reluctant to, go ahead. Did I hear someone else?
Paul Beveridge here.
Yeah,
I was just hoping to interject something really quickly.
Yeah, sorry.
For those of you who have been coming to these meetings for a long time, you know, I'm one of the people that favors free and fair markets. And whenever I hear people suggesting that increasing enforcement of trade practice rules, I need to remind everybody that the reason those rules are still in existence is because they protect some of the people in this room and their clients from free and fair competition. They also keep a lot of lobbyists employed in Olympia. If we really want to take care of this problem, we should legalize shipping by retailers, by wine retailers, collect taxes on it, and regulate it. That's the best way to do it. When we do protectionism, we detract from the liquor board's public safety mission when we enforce these antiquated trade practice laws. And as we know from the tariffs, all protectionism benefits the few at the expense of the many. So the real loser is the public, which is paying a little more for alcohol than it should because we have these practices that help middlemen take an extra cut. So just want to get that down on the record for everybody when we think about trade practice as opposed to public safety regulation.
Thank you, Paul. No one can say this isn't a vigorous conversation on many fronts. But we have at least three that folks that we haven't heard from. I'd like to go to Josh McDonald. And thank you.
He did have his hand up, was online, but he's.
Okay.
Message. We really want to thank everyone who'll be reaching out. We really appreciate it. Together.
Okay, great. Thanks, Sean. Sally Jefferson. Are you still with us?
Yes, I'm here. Well, not to belabor the point that you heard from a number of industry colleagues here, but it is an incredibly difficult, challenging time for the wine industry and anyone that's distributing or selling alcohol beverages and producing them. So with that said, I did want to point out how much we appreciate the process that has been undertaken for the product placement rule. You know, the listening sessions this past spring, the openness to hear comments and feedback on that, and then taking that feedback and making changes. And so I have to tell you, we very much appreciate that, the process to date. And when the next draft comes out, you know, having further opportunities to weigh in and weigh in on the proposal. In addition, I just want to say we don't have, you know, any issues for the 2026 legislature. I mean, really, our focus is going to be on, you know, working with other stakeholders on issues that may affect our products. And then, you know, lastly, just to say how much we appreciate the work and the staff at the LCB, how incredibly responsive and helpful that they are, as well as to the board for reconvening this group for us to share and talk about issues that are on our mind. And so anyway, with that said, thank you.
Thank you, Sally. Roland Thompson. I would give anything to get you up here and closing us out.
Thanks for coming, everybody. Oh, sorry. Thanks for coming, everybody, and we'll look forward to seeing you next time. No, let's see. Just to echo what Sally was saying, we don't have anything that we're trying to push, but the decline in consumption, particularly by younger people, is really troubling for the wine industry. And it looks like it's a trend that is not going to change. And so anything that can be done to try to bolster that, as Paul says, would be very helpful. And I guess I'm sort of speaking for Josh as well in that sense. It's tough times out there, and it isn't just the economy. The country's changing socially, and tastes are changing radically. And if you're on the upper end in terms of pricing, you're really suffering. And so there are changes that are going to happen, and hopefully the wine industry can adapt to that and still continue to be vibrant in this state.
Great.
And with that, thanks for coming.
Thank you for being here with us steadfastly for 2 hours. And before I close it, is there anyone I've missed? Anyone else online or anyone? I just want to make sure we've had an opportunity to hear from everyone. It's been a rich and robust conversation. I've learned a lot. I know that. And I wanted to echo what our chairman said. I agree. His philosophy and mine are quite similar on these fronts. Public health and safety has to be a focus of the agency. And when it's data driven, that's going to mean for better decision making. And at the same time, I may have been a prosecutor. I tried to use data to when we enforced criminal laws. When I was with the city of Seattle, but at the same time, my career has been focused on commercial litigation, commercial law, and I can read a profit and loss statement. We know that the industries we regulate also provide lots of revenue and jobs in the state. And so while keeping the eye on public health and safety, we are also mindful that we can do things better if we learn from roundtable discussions like this, council meetings, then we're going to do a better job and our regulated industries are going to be more successful. So I think one goes hand in glove with the other. And I think everyone around this table should really be lauded for the work, the professional effort that you're bringing to the table, and then just the open communication. So thanks everyone for being here. I look forward to the next meeting, and I'd love your post-meeting comments to hear, what topics you would like us to drill down on. We covered such a broad array today that, we can easily devote subsequent meetings to individual topics and make sure we have our subject matter experts here and hear from you. So with that, unless there's any other questions or anything else for the good of the order, this council meeting is adjourned. Thank you. No, we did chew up the rest of our time.